Concussion is becoming kind of a cool injury in the medical space. A lot of providers are now excited to say that they do concussion. And so with that, you'll find a lot of different specialties in a lot of different areas reaching into the concussion space saying they can offer you help. And I wanted to give you 3 things to look for where you're kind of in a messy gray area and not working with someone who really, really knows what they're doing. I'm Dr. Mark, concussion specialist. This is all I've done for the last 5 years. I speak on the topic. I teach other providers on the topic. So I can comfortably say I know what I'm doing, and I can comfortably also say that there's a shit ton we don't know about concussion, but the stuff that we do know is getting more and more clear. And so the 3 things that I would say to look out for, number 1, autonomic dysregulation is so prevalent in concussion. So not overt POTS all the time, not overt orthostatic hypotension, but just an imbalance between sympathetic and parasympathetic regulation. And it's not an on and off switch. It's kind of a gradient. Sometimes they're both active at the same time. And we need that. That's normal. But what you should see is them testing orthostatic vitals, meaning they have taken your heart rate and blood pressure, lying down, sitting and standing up, or some variation of the type. And they have done some sort of exercise testing. So they've thrown you on a treadmill or a bike, they've measured your heart rate, and they have objectively assessed your exercise tolerance. Step 1 is they've looked at your autonomic system. Step 2 is that they're providing a reason for what they are doing. We know there are symptom generators in concussion. So there's autonomic dysregulation, there's metabolic hormonal dysregulation, there's visual vestibular dysfunction, there's cervical spine dysfunction, and there's psychological overlap. And we know that there are validated tools and there are validated things within the concussion space, the post-concussion symptom scale, the VOMS, the Buffalo Concussion Treadmill Test. There's different things that we're doing that have a purpose to address the symptom generators of concussion. If you can ask your provider, hey, why are we doing this? Why aren't we doing X, Y, and Z? They should be able to have an answer for you. And that leads us to the 3rd thing, that they're not just jumping at buzzwords like inflammation and neuroplasticity, because those mean almost nothing. Inflammation is prevalent in any condition. So it's everywhere. So this targets inflammation. Okay, well, what doesn't? And then neuroplasticity. Neuroplasticity isn't always a good thing. Neuroplasticity is just kind of a buzzword right now. So chronic pain is an example of bad neuroplasticity. Learning music is an example of good neuroplasticity. It's like, okay, you're just saying neuroplasticity. What does that mean? So they're just giving you a shotgun of supplements, and it's a bunch of nootropics and adaptogenic mushrooms and different things. We really don't have the evidence for it. We don't have bad evidence for it, but it's not a needle mover in concussion. The big needle movers tend to be just your basics, your creatine, your fish oil, your curcumin, maybe N-acetylcysteine, things like that. When you get into these fancier adaptogenic things, that's when it's like very patient specific, and it shouldn't be the shotgun that you get right out the gates because I heard it's good for the brain, right? Just because it's good for the brain doesn't mean it's good for concussion. Those are 3 things I would look for. Big needle mover is autonomic assessments. They should be doing some sort of orthostatic and exercise testing. They should be able to explain why and what they're doing and where your symptoms are coming from and answer all of your questions about that. And they shouldn't use buzzwords like inflammation and neuroplasticity without strong evidence to support it. You shouldn't just be getting a shotgun protocol. Let me know if you have any questions about concussion. Leave them in the comments.